The Nigeria Center for Disease Control and Prevention, NCDC, said it has recorded 1,068 Lassa fever cases across 112 local government areas in 28 states of the Federation. The NCDC revealed this in its Lassa fever situation report for week 37, which is between September 11th and 17th, 2023, released on Monday. According to the NCDC, suspected cases are now 7,352, and that the disease killed no fewer than 181 persons in the country. For the current death toll, the agency noted that the case-fatality ratio of the outbreak stood at 16.9%. Lassa fever remains a major public health challenge, as poor environmental sanitation, poor awareness, and late presentation of cases are reported to fuel the epidemic in Nigeria. Now, join us in Nigeria tonight to give us more insights on this development. We're joined by Professor Philip Njemanze, a public health expert and chairman of the International Institute of Advanced Research and Training at Chidicon Medical Center in Owerri, Imo State. Welcome to you, Professor Njemanze. Thanks for joining us on the news.
Thank you for having me.
Now, Prof, the NCDC said the suspected cases are now 7,352 and that the disease has killed no fewer than 181 persons in the country. Is this something we should worry about?
Well, Lassa fever has been an endemic disease caused by mastomys rats. And it has been with us for a very long time. And there is this peaking of the infection between December, this present one started in December 2022, and then up to April, it peaks, and then there is a slight slowing of the infection. So this is a very endemic disease. Most of it goes undetected because most people will come up with being asymptomatic, so you couldn't really see any real manifestation. Then if a few of them will come up with fever, and some of them can go on to be hemorrhagic. That means they kind of start vomiting blood start coming from different orifices of the body. So it is, I must say that it's not a big surprise that we are having these episodic outbreaks because it's an endemic disease in our country. However, the good thing is that one must commend the NCDC here, that the surveillance is much better. We have much better case detection. There is much improved diagnostics. And there is a high suspicion index now, which is very good because we can now know that this is happening and where it's happening at the time it's happening. So this is a welcome development. However, we need to improve the case detection very, very early so that those people will not progress first into very severe cases. And there are certain practices that could be caught by education of the population. For example, most of these infections would occur when people start processing food, like garri, which they spread outside in during the dry season. And then when they do that, then these mastomys rats go urinate on them and, of course, pass feces. And these people will eat this garri even when they smoke it without really processing it with hot water. So this is one of the easiest way that this infection is passed.
Now, Professor Njemanze, is it communicable where a person has symptoms when a person is infected with Lassa fever? Can it spread it to a fellow human being?
Yes, it could because passing fluid, that is blood, urine, from a person who is infected onto another person could pass on the infection. But most times it's actually with household items like food that is kept not covered, and things like garri, which which attracts rats, and this could actually be a very major source of the infection because these rats will urinate.
Before I let you go, Professor Njemanze, apart from proper storage of food and discouraging open drying of foods like gari, what other measures or steps can Nigerians take to curb the spread of Lassa fever?
Yes, actually, food is a major source of this infection, and the way we keep things for marketing, you see things are spread outside on the floor. This has to be controlled. We need to bring back the sanitary system, which controls food items and the way they are disposed of. On the way they are placed in the places of sale, especially in the open market.
Thank you very much for your time, Professor Njemanze, for talking to us in Nigeria tonight. We do appreciate your time and insight.
Thank you for having me.
Thank you.